meant to reach out to Phil. Cliff. There it is. Here we go.
Sounds like you're on already.
Alrighty. Peace and blessings, family. This is Brother Shareef with Hour of Power, along with my good brother Ptah Shakur. We have our guests here. We are going to hold on a second here. We are going to start out with our universal prayer and our nugget of truth, and then we'll get into this much anticipated interview with our good brother here. So, in the name of God, the gracious, the merciful, we give him praise and thanks for his mercy and his goodness to the human family. If all the trees upon the earth were pens to write with, and if all the oceans were ink, and then another 7 oceans to add to its supply, the writing would still not be enough to explain the glory of God, for he's the gracious, the merciful. We praise no other in our time of need, and we confide in no other in our time of need. He is one. And even if I lived to be 1,000, it would still not be enough to thank God for his many blessings and gifts. We thank God for the Metu Neter, oracle scriptures and writings that came on the continent of Africa thousands of years before any organized religion. We thank God for Moses in the Torah, Jesus in the Gospel, and Muhammad with the Quran. I greet everyone in words of peace. To my Christian family, praise the Lord. To my Muslim family, assalamu alaikum. To my Hebrew Israelite family, shalom. To my Black conscious family, hotep. To my Native American family, halito. And to my people in the streets, what's good to you? It all means peace. We at times do a nugget of truth. A nugget of truth is just us explaining our history, since it's not being properly explained in learning institutions. I thought it was fitting for our nugget of truth this week to talk about, just real briefly, the first mental asylum for black people in America was in St. Petersburg, Virginia in 1848. It was called Central State Hospital, or back then they called it the lunatic asylum. That's the way they explain mentally ill, so supposedly people. Listen to the year 1848. What was going on in 1848? Slavery. They would put different, not different, but people who were supposedly mentally ill, who were slaves from Africa, in this central asylum. And the way they accumulated wealth was the patients were also the workers. The patients were the workers. So if someone will go to the Central Lunatic Asylum, as they called it, and said, I'm here to visit Uncle Leroy. Well, he's busy right now. What do you mean he's busy? He's toiling the field. He's in the kitchen. Well, I'm here to visit Aunt Betsy. She's in the kitchen right now. So they didn't have to have any overhead. The overhead, they got money from slave owners who they said they were out of control, what they called dreptomania. Dreptomania is a term, it's still in the general archives, meaning these people were was apt to run and destroy their master's property. So that's still in the archives, called dreptomania. So they would put the unruly African slaves in this central asylum. So they got money from the slave owners, and they didn't have to pay anyone because they were the workers also. Many of the patients were sexually abused, physically abused, and then from there, from St. Petersburg, Virginia, in 1848, many other central asylums was developed, and they would say that whites their mental health would be impeded if they integrated with blacks. So I had to, how the blacks was there. I could show you pictures, and you could Google this, and you'll see African slaves in the kitchen at this central lunatic asylum in St. Petersburg, Virginia, which ain't far from here now. So you could do your own research. It's called Central State Hospital, but back then it was called the Lunatic Asylum. That's what they called mentally ill people. But of course they cleaned up the language to describe those who are mentally ill. So we can't get a break nowhere. We can't get a break nowhere.
Maybe in 2025, maybe.
And guess how many patients they had there?
How many?
12,000.
12,000. Wow.
300 in one room. 300 in one room. In the institution looks like a college campus. 12,000 African slaves and others. If you had a disagreement with the law enforcement back then, they would take you to the Central Asylum.
Yeah.
And
They had a very low threshold.
Yes. Even
had to
during
get them numbers.
even during the days of back in the 60s, many of our freedom fighters just disappeared. Many of them went to these different asylums around the country once they started spreading the idea, which originated in St. Petersburg, Virginia. Just disappeared.
Any dissonance, just
Yep. So, without no further ado, we have our good brother here. Introduce yourself, and we are more than excited about you sharing your knowledge.
Yes, sir.
Great, thank you. It's such a pleasure to be here. I really appreciate the invitation. Since we will be talking about a subject that is extremely important, mental health. My name is Gracia Etienne, Dr. Etienne. I've been in practice for quite a while now, and I'm looking forward to have an interview on mental health and cover that important subject.
Yes.
Beautiful, beautiful. And if I may chime in real quick before we get into the crest of the conversation, remember this is a live call-in show coming out here live from the White Rose Community Television Broadcasting channels, Channel 16 here in York, Pennsylvania, and also going out on live on Facebook and then on YouTube as well. So we want to hear from you. The call-in numbers on the bottom of the screen. Get involved with this conversation. We have this great mind here sharing wisdom with us as far as alternatives. I mean, a lot of individuals that I speak to are really becoming more aware of the effects of certain type of pharmaceuticals and medications. And so if you're looking for an alternative, if you're looking for a possible something new and different when you're going into this new year, I recommend everybody give this a listen. We're going to be going on to a 9 o'clock on the White Rose Community Channel 16, and on Facebook we may go a little bit longer as well. So feel free to call in, and I'll kick it to the brother. And yeah, you got any questions, Shareef?
No.
We already got people lined up on Facebook already.
Can you tell us how you got started in your field and in your location here in York?
I was actually an orthopedic surgeon, which is I'm still a board certified orthopedic surgeon.
Wow.
And I had some medical issues and preventing me from doing surgery, continuing to do surgery.
And real quick, not to interrupt you, exactly what is a orthopedic surgeon?
Orthopedics, we take care of bones, management of bones and joints and articulations. So essentially from spine and fractures and joint replacement. And in fact, I was a subspecialist in major joint replacement, shoulders, elbows, and hips.
Wow.
Yeah. So that kind of grueling in terms of physical activities, and I started developing some inflammations preventing me from being as effective as I wanted to be on that. And during my medical leave of absence, and I was approached by people who knew my reputation and asking me whether or not I would want to manage a mental health clinic. Honestly, I was a little bit reluctant the first couple of times.
Kind of a change.
Exactly. They approached me. That's quite a change from orthopedics. But after doing my research and seeing the success rate of the treatment in question, I decided, it's not a bad idea to actually continue to do it, because that will give me a sense of purpose. I feel like I'm still helping in the community. I'm still being able to continue my mission to help my fellow human beings. And that's how I got involved into this.
Mm-hmm. Now, before we came on, you was sharing with me your background and culture with Haiti, what you just explained about the orthopedic part. did you start that here or back home?
No. Going back to my education, I actually went to college at Seton Hall University in in New Jersey,
Right.
followed by medical school in Hershey, Pennsylvania. Then from there, I did my residency in New York at SUNY Downstate in New York. Then I did 1 year of subspecialization. It's more like a fellowship, we call it, in joint replacement and adult reconstruction at Johns Hopkins. I stayed there for about 4 years before moving up to York in 2005, and I've been in practice in 2005 in York until this year, actually, in August of this year.
What brought you here? It's such a small place from Seton Hall. That's in New Jersey, right?
Yes.
What brought you here?
My trip back to York, I have to credit that to the residents that I was really teaching. They enjoyed my style of transfer of knowledge. I don't want to call it education, but my transfer of knowledge to them. And when I decided to leave Sinai Hospital in Baltimore, they kind of hold me back and say, you have to stay in the system, you have to continue. And so they arranged things for me to come back to OSS, to come up here to OSS. And
I've heard of them.
When, yeah.
Okay, so that's the same thing, broken bones and
exactly
different things like that. And repeat, how did you make that transition from the orthopedic to the mental health?
I was approached actually by the company that have the chair, that manufactured the chair for the treatment, and asking me whether or not I would be willing to help manage a clinic in this area. And when I looked into it any further, I realized that it was it was not hocus pocus. It is actually a proven effective treatment. So therefore, to me, I feel comfortable handling it.
Okay. The way you treat mental health, when I first heard about you through Miss Sita, that was very intriguing. Can you inform us about that and the need for it?
Yeah. This clinic is focused on TMS, what's called TMS, and TMS stands for transcranial magnetic stimulation.
Wow.
And if we don't get anything else out of this entire interview, as for the one thing to remember from TMS is that, number one, it is non-invasive, so it's not medication. Number two, there is no side effect whatsoever with any medicine, and there is no interaction with medicine whatsoever. And it is proven, effective, and trusted. It is approved by FDA and covered by most insurances. So therefore, it is a well-respected treatment that's been offered in the United States since 2008, and there are millions of patients and millions of treatments done at this point, and it is a well accepted treatment. So the fact that it is not, I need to also add that if anyone remember electric shock therapy, that's probably one thing that you may want to put your mind into it, but immediately I would say just forget that, because shock therapy involved electricity. But TMS, it uses magnetic pulses, just like if you're getting an MRI, for example, and that's the low intensity. So because of that, it is it is well tolerated by patient. There is absolutely no contraindication. So like for example, for ECT, the electric shock therapy, the patient has to be under anesthesia or at least be sedated. It has to be done in a hospital setting. But TMS, because of the low intensity of the magnetic stimulation, can be done in a standalone clinic center.
And that electric shock therapy, I believe they use that, of course, in an abusive way at that Central Lunatic Asylum that I was talking about
Yeah.
earlier. Is that correct?
That is correct. Yeah, electric shock. Unfortunately, electric shock has been used for other treatment also. Well, not treatment actually. For other things also, and because of that, the electric shock therapy for depression had a very bad press, really, and plus the side effects in terms of seizures and the fact that the patient had to be under sedation or anesthesia of some sort makes it a lot less attractive compared to other treatments. Yeah.
Wow. You got anything, Phil, you want to ask?
Yeah, absolutely. I was watching this documentary, just proving that how we are electrical beings, and so how this makes sense. Dealing with magnetics. What they did is they had this real sensitive equipment, and they put an individual into a dark room. This equipment can detect light, in the most faintest degree. And so when they put a person into a dark room and put on this particular this sensor, they can detect light and electricity that actually comes from our face. So it makes sense when you're talking about the transcranial magnetic pulses that we are. Partly, would you say that we're like magnets ourselves, or would you?
Yeah, this is actually a nice segue into how a transcranial magnetic stimulation (TMS) works.
Yes,
Essentially, the cells in the brains they communicate through electric field or magnetic fields, and we call them synapses, so they connect. Yeah. So therefore, when you have a patient, for example, with depression, and in fact, there are PET scans showing that if you have a patient with depression, those cells are dormant, so they're not connected. They're not sending signals to each other. So therefore, if there is no signals, the brain basically goes to sleep, and there's no activities going on, and that will affect mood. That can cause depression, anxiety, and so on. And the way the magnetic pulses work, it's by reactivating and revitalizing those neurons and recreating those synapses. And the good thing is those reconnection can actually be permanent. So, and that's how the response is. And in fact, there are studies showing a PET scan of patients with depression versus a PET scan of patients without depression or after the treatment. And a PET scan, what it does, it measures the amount of blood flow and oxygen consumption as well as glucose metabolism, all of that basically to say the degree of activities that's happening inside the brain. And then when you take the MRI of patient, or the PET scan of patient with depression, it's completely dark. There's absolutely no activities going on at all. And then when you take the one with the after treatment or a patient who does not have depression, I mean, that thing just light up and clear. You can clearly see the difference. Yeah.
Wow, beautiful.
Once someone comes in to receive treatment, what is exactly like a treatment plan during the treatment, but most of all afterwards?
Yeah.
Or concurrent, with a treatment. You just don't say, okay, here's a little treatment and send them off. What's the treatment?
Yeah, the way the process really starts, it's with a referral. Okay, the referral can be either from the patient directly, because there can be self-referral, or from a provider, either a primary care doctor or a psychiatrist or a psychologist referring the patient to us. So what we do first, what's called a consultation, but it's more like an informational consultation. Just have the patient come in, go over the entire process with them, make sure that they understand. I am a great proponent on feeding my patients information, because I always say that the most compliant patients or the best patients you'll ever have, it's the informed patients. And honestly, out of just pure respect for the process, if you're gonna touch someone, they need to understand what they're getting themselves into and completely. So when that's done, we do a psychiatric evaluation to follow if the patient wants to continue with the treatment after being well aware of what everything is. So once the order has been placed, and we determine, or the psychiatrist determine that yes, TMS is a good indication the patient qualified for that, that patient will come in. we do what's called a mapping. And what it is, the area that controlled mood and subsequently depression and anxiety is actually about the size of a golf ball or so, and it's on the prefrontal cortex laterally on the left side. So instead of sending the pulses of magnetic over the entire brain, we localize exactly where it is. So it's more like a focused treatment that is individualized for that particular patient. So that's what the mapping is. And then the rest, it's more like proprietary things from software and so on that determines how long we should do it. Because with the mapping, we can get the intensity, we can get the location, and as well as angles and tilt and everything. You can do all that. And then the machine itself with the software will help us determine how long each subsequent treatment will be. And so far, the average is about 19 minutes or so of per treatment, per sessions.
Excuse me, just for one moment. I don't know if you want to get your phone. Do you want to share this on your particular Facebook page, or you just want to wait?
Yeah, we'll wait.
Oh, okay, no problem, no problem. I just wanted to give that option right there. But go ahead, Shareef.
What kind of communication do you have with the client? I know, like you said, it's individualized, and that's what I like. It's not a across the board, treatment. But what communication do you have with the client, depending on, like, say it's anxiety? I ain't afraid to say it. I suffer from anxiety. What is it that you do after that initial treatment? To help them along in that journey. That's a monster, man.
Yeah, the total treatment, it's about 36 sessions. And through that entire time, every time the patient comes in, we have a scale. So you can score the level of anxiety or the level of the depression. And again, the tools that's being used, it's a validated tool that is used across the board in medicine. So to be able to determine the degree of anxiety or the degrees of depression or the severity, if we can even use that term. So every week we do the test to see if and how the patient is progressing with the treatment. And after the treatment, we tend to do a follow-up, either a visit or a phone call or a consultation, whatever the patient feels comfortable with, in 3 months later, 6 weeks later, 3 months later, and see how they're doing and just continue with that.
So is it like therapy sessions in between, or is that something separate?
That is allowed, but that's something separate. It is allowed. I mean, we typically ask patients not to change their usual habits, and if that's, I know it's a double word, but yeah, because we don't, when we do the mapping, it's based on the patient's quote unquote current state, so it's contemporaneous. So therefore, we want to continue with that. We don't want any added consumptions of any medicine or anything to change it. So continue the same thing, and after the treatment, patients will start weaning themselves off whatever they were taking.
I was getting ready to ask you that if they're on current medications, do you try to, wean them?
Yeah, they will wean on them, and that's the sweet part of it. Actually, 83% success rate with 62% remission rate. So it is, I mean, again, for something that is not invasive and no interaction with medicine and fairly effective and so on and so forth, I think it's really great to be able to quote those kinds of numbers. And plus, those numbers, the percentage of success that I'm actually quoting right now, that was done on patients who have medication-resistant depression, which means that those patients have tried 2 or 3 medicines. So they are, if we can use that term, the worst of the worst, actually. Yeah, and they are the one that are responding. Because if you read the literature, the success rate for antidepressant medicine, if the patient is taking 1, it's about 26%. By the time a patient is taking 4, the success rate dropped down to 6.9. It's below 7. Let's just say 7 let's round it to 7. But here's the other side also. The more medicine they add, the higher the side effects. So it's about 8%. It's about 8% if they're taking one med, and by the time a patient is taking 4 medicine, the side effect is about 41%. And obviously, those patients will drop. Yeah. So the compliance just so dropping, because if I'm taking 4 medicine and I'm not getting the results, number one, and then I'm having side effect, well, I know what the answer is.
Wow, this is some really great information. There's
Yeah.
a lot of people that are suffering
Yeah.
that fit in that demographic.
Yeah, because the thing is, people have to understand that there is another option. More medicine is not always the answer.
For sure.
More medication is not always the answer. I mean, there have been some problems, some medical issues where unfortunately you have to take 2 or 3 meds to get you. But for depressions, you have to understand that there is a non-invasive alternative, and more medicine is not always the answer.
Right. And just a few minutes ago, you had mentioned weaning them off of the medicine. You can't be a good friend of CVS and Walgreens and all that, because you're putting a monkey wrench into their business, which I'm glad, but I'm sure that's not what they want to hear. How, have you got any negative
No,
feedback?
I mean,
Not really.
I mean, I think because TMS is FDA approved and it's covered by insurance company, I think we feel comfortable talking to anyone. And interestingly, I tend to mention that sometimes. I don't know if I but this is probably one of the few, if I can even remember, treatment that a patient can self-refer.
Okay.
An insurance company will be okay with that.
Wow.
And then, I mean, insurance companies, I mean, they want to be tight along that way. Sure. So to be able to, they would accept that, because as long as the patient has tried 2 meds and is not doing well, that's a good indication for this treatment. Non-invasive, very effective, proven, trusted.
I have a quick question.
Yeah.
Because also what you were saying about OCD, would that also include? I'm kind of ignorant of something like ADHD. I was always working with youth, and so I would just see it with a lot of youth. It's really troubling that there's so many different of those different type of things. So how does that relate?
Right now, the approved protocols are for depression, anxiety, and OCD. Okay. However, there are studies going, because again, remember we talked about the location of the brain that controlled mood, and so you cannot go to FDA and basically say, okay, now the treatment works for everything. So you really have to prove it. Exactly. You have to prove it, and you have to give to prove not only your protocol, and then you have to have studies. And I can tell you right now that there are studies going on for migraines, for ADHD, for traumatic brain injuries, and so on and so forth. So all of that is being worked in. It is the indication is being expanded. Yeah. While I'm in it, while I'm there, I should mention that also there's absolutely no effect on memory. On that, so there's no memory loss. There's no, it doesn't affect the patient along that way. And in fact, during treatment, the patient will actually be wide awake talking to us. I mean, I'm not a therapist, or my treaters may not, but they can still have conversation talking about the family members and all issues, and be fine. Yeah. So you expect it to be wide awake, and patients will go ahead after the treatment and do whatever you want. And we have professionals, let me just leave it like that, who would come in the morning, get treated, and then go finish their day. No problem.
No problem.
No problem.
To your knowledge, is there any other treatment in York County like yours?
Yes, there is another center in York County. Yeah.
Oh, okay. The reason why I was making a point about CVS, and probably a big friend of yours, Miss Sita, made a good point here. You want to read that, Phil?
Sure. Thank you for your response there, Sita. as well as anybody else who's watching. And please, if you're not going to call in, you can please leave a message there on the Facebook comments as well. But she loves your enthusiasm regarding the treatment. The passion is something that you you don't see much in Western medicine. But it says healthcare in America would love to keep a person sick. There's no money in the wellness, but she basically is just touting, you, and as far as your enthusiasm and the knowledge that you're expressing.
Yeah, I mean, we know that prevention and alternative medicine or non-invasive medicine is not usually that welcome because that's not where the big dollars are.
Yes, sir.
Yeah.
Mm-hmm.
And a lot of people don't know. I ain't trying to scare them, but pharmacy is a Greek word that means magic. So CVS pharmacy means magic. They're telling you it's not to heal you, it's magic. Anyone can look it up right now. Pharmacy means a Greek word that means magic. So hey, take it for what it is.
And I do have just another little quick question, because I mentioned before that I have a holistic health center as far as, and one of the things that we find, there's studies about foot detox and autism as far as heavy metals. I know it's a kind of conspiracy, some people saying there with vaccinations and things of that nature. Does the heavy metals that an individual consume, would that have something to play with the synapses in a person's mind, or is that something that's completely kind of unrelated?
Actually, it can cause imbalance.
Okay.
Yeah, and any imbalance in your in your electrolytes, and obviously any metal consumption can cause that. Yeah.
Okay.
Yeah.
Mm. And we were talking earlier, Doc, about the resistance of black people here in America, especially black men, of wanting to accept that there is even an issue. We suffer so much. I can speak for it with me being a therapist and just being in a community. The acceptance and or the resistance of mental health is really an issue in the community here. Have you noticed that? Or once someone comes to your practice, they're past the resistance stage? Is that?
Yes, I mean definitely. By the time they come in for treatment, I think there is a little bit of window open there for us to soften them a little, quite a bit. But yeah, I agree with you. Part of it, unfortunately, we have to admit, it's our society kind of pushed the macho man concept. If you ask for help, you're weak. And
Right.
so there's that stigma about depression, plus the stigma about depression itself, which is like, in school they make fun of you, the kid who's quiet. Everyone think that he's not smart enough. He may have the best grade in the class and everything, and people just still make fun of him, and that carries into our society as you get older. And if you're not the big guy who is pushing and so on. So I think what we're doing right now is really good, because that can go a long way in re-educating people and making sure that they understand that there's nothing wrong in asking for help. And in fact, you ask for help every single day, because the gas you put in your car, you didn't make it, someone made it. So just your well-being, your mental well-being is actually very important. The stigma against mental health has to go away.
Mm-hmm. But I believe that's why I started out the show about the Central Lunatic Asylum that started. This is a long history of where black people, for the most part, not the most part, but it's very impactful that they don't trust the medical field, period. And even when you get to mental health, they think that someone is going to label them. That goes back to biblical times. You read some of the prophets, they said they're going to think, he said to God, they're going to think that I'm crazy. So that label of being crazy and unstable goes back to biblical times, bringing it up to now. A lot of people think, black people think that they're going to be stuck with medicine, labeled as being crazy. and that is really impedes them from moving forward.
Yeah. Plus,
So,
if we add, if we remember the Tuskegee
experiment, yeah.
experiment, that I mean, things like that. You, they will have an impact on you. So there's no doubt. Yeah.
Wow. Got anything?
Yeah, we
Phil, you
do
wanna
have
do?
a question. Thank you for Miss Tina. She has a question there. She's presenting. Are there any studies on this treatment for people struggling with depression, anxiety, and early mid-level dementia? I know you kind of went into some of that, but the little caveat she has in there, like early mid-level dementia. If you can, maybe she might have just kind of popped on. If you can kind of answer that question for Miss Tina.
Yeah. The indication itself is for the indication of TMS is for depression and anxiety. However, that being said, it is quite often we see the improvement in patients' mental status in general, including their memory and so on. But however, I think we would be very cautious in telling people that it is being done for dementia. It's not being done for that purpose. But most patients, once they feel better after treatment of anxiety and depression, they are able to manage their life better. So their life become more manageable, and including their overall health, and obviously some early mental memories changes as part of your overall health. Yeah.
Yeah, there we go. Our brother Ptah just put the address of your practice, 1806 North George Street. Is that correct?
That is correct.
Yep. And as we were talking earlier, location-wise, it's right when you cross over Route 30. Would that be on the left if we're heading out that way?
That is correct. If you're heading toward Manchester, it's on the left-hand side. Yeah.
Right after the CVS.
Right after the CVS, there's the PA. Yeah, there's the PA Health Department there, and then we're right after that. Yeah. And I know I'm not doing a publicity for our clinic, but I can add really that we have a very well experienced staff there, and I can glow in saying that our treaters are very caring, and in fact, I tend to even tell people that.
That's what you're here
I tend
for.
to even tell people that for as much as we call it treatment, for me it's more. I prefer the word caring, honestly, because the time that we spend there talking to those patients for the 19 minutes that they are in the chair being treated, the conversation that we bring, you can clearly see people who are a little bit tight in the first couple of times, and how they open up with us, and by the third or fourth treatments, it's almost like patients come alive. Basically, honestly, you can clearly see the difference. I mean, I call it life changed. Really, the way you can see it in those patients, and people telling you how they can manage their life back. To me, I mean, I can get very excited. It's interesting for an orthopedic surgeon to be so excited about mental health, but I can get very excited talking about this.
Someone asked, but Ms. Sita kind of answered, do you accept all insurances?
Yes. I mean, most most of the major insurances would cover it, and in fact, what we do as part of the process, we always do what's called a benefit investigation before we start the treatment. And what the benefit investigation is, it's to really making sure that we reach out to the insurance company and say, patient Smith is coming in for treatment. We want to make sure that either the card doesn't expire, their coverage doesn't expire, and everything, and you guys cover this treatment for them. And then we also determine if the patient has a copay or a deductible. That way, we make sure that the patient is aware not only of all the treatments and everything, how things going, but also their potential financial responsibility if there is one. That way we don't have any major surprises at the end of the treatment. Yeah.
And question I had, have is, because of the pressure of society with our young people, we're finding more young people, especially with me being a therapist, going into the home. A lot of more young people are struggling with mental health. What's the age range, or is there an age range with your patients?
Yeah, at this point, it's adolescent up to age down to age 15. So again, simply because 15 and up, 15 and up, yeah, 15 and up, yeah,
So not
15 and up, yeah.
not real young
No.
people like
Yeah.
7, 8, 9.
Yeah,
10.
part of it is because to do research and put on the pediatric population, there's so much more that you have to go through because they can consent to things and so on.
Right.
Expressing
You're
so
right.
it's 'Cause
really
really
my clients
tight.
can sign off
Yeah.
on their own treatment at 14.
Yeah.
So yeah, you're right.
Yeah, so it's tough.
Right
So
about that.
yeah, so the adolescent program protocol now, it's really going well, and there's a very good success rate with that too. And you're really touching on a very interesting subject, mental health in our adolescents right now. It's not a joke. It is not a joke.
Sure.
I mean, we can have different theories and agree on why and not, but we can't disagree on the fact that it is there. It's really, the prevalence is really way too high.
Mhm. We just you just said you take most insurances, but someone asked, do you take Aetna Bronze?
Yes, we do. We do. The other thing also, while we're on that subject of payment, and because I'm actually not the the right person to talk about money. I hate talking about money, but I'll cover that anyway. There are people, even patients or people, I would say patients who do not have insurance and who want the treatment. We partner with 3 financial institutions that would finance the treatment also. And to me, I mentioned that not because of the money part per se, but to show again how this is a trusted.
Yeah, it's backed.
This is a very
It's very
trusted.
has a foundation.
That's how fun. I mean, for financial institution to feel
about
comfortable to put their money behind it, so it has to be
With the youth that I know you said the cutoff age is 15.
Yes.
Do you do individual assessment with them called the ACE study and survey?
Yeah, we do. We do have a validated study, and that's part of their patient health assessment. Yeah.
Yeah. And for those who don't know, ACE study and survey means which is advanced children. I forget.
Yeah, I don't remember what the SAG stand for. Yeah.
Yeah. So basically, that lets us know, or let your practice know, if they've been a part of any trauma.
Yeah.
Do you find that's linked towards depression and anxiety?
Definitely.
Yes, indeed. Any
Well, what I find interesting, I find it's kind of humorous in a way. Just seeing how you transition from being an orthopedic surgeon to where it is now. I was just watching the Doctor Strange, and that was one thing. Doctor Strange, he was a surgeon, and he went on to some other type of forms. I was like, man, this is a whole nother form. So I really thank you for of taking that leap and actually providing this opportunity for people. Because this is something that is really, really needed. So I just want to add that in there.
Thank you.
And I would imagine your practice is pretty diverse.
That's correct. Yes.
Mm-hmm.
Yeah, that is correct. Yeah.
That's great, man.
I mean, honestly, it is really a joy to be able to manage that, help managing that clinic, coming from my background. Yeah, I mean, I think I'm pretty well versed in medicine, although I subspecialized in orthopedics. So my reluctance was more because because of the fact that it was a surgical specialty that I'm leaving. But once I passed that stigma and read more about TMS, and figure out exactly then and find out that this is about helping people. I mean, I can understand it's broken, it's you fix it, or it's it's bad, yeah, you take it away, you replace. But at the same time, when you watch a patient life changed in front of you after the third or fourth treatment, I can tell you get a rush, just like you just get a rush just like anything else. I mean, when someone comes in and said, "Oh yeah, I can manage that and the other better now," that is special. I mean, we even have patients who didn't really realize how well they were doing. So you ask them, and they're like, "Yeah, I don't know," but their family members would notice. Yeah. I mean, I vividly, again, I can say that because I'm not putting patient's name. I vividly remember a patient who lost a dog during the treatment, and her family was so happy that she was getting treated because a few years prior she actually lost a dog and she was a mess.
Okay, so they see the difference.
She was, and then she managed that very well. She processed it very well doing it, and and it's. I mean, again, this is real.
They're like a family member to some people.
Yeah, I mean, and this is real when someone can go from that. Yeah, it's not a joke. It's a real thing for them.
And there's so many different stressors. I know we kind of speak on this program before, and to speak what Shareef was saying, individuals that don't want to get diagnosed, there's a lot of different stressors that are going on. So if you're listen on Facebook and listen on the White Rose Community Television. If you want to call in, we got about 20 more minutes. Get to wonderful knowledge, get all your questions answered, because we know we're moving into some.
Please call in.
Yeah, I mean, you can't. You're not missing anything. You're not losing anything by just getting evaluated. Just see if this is something that you can benefit from, and that's, to me, it's a no-brainer. I mean,
the research too.
Exactly.
And when they go on the website there, the York TMS.
Yeah, the website is www.yorktmsclinic.com.
Oh, clinic.com.
Yeah, yorktmsclinic.com. Or you call the number that's right on the screen there.
Hey, Ptah, could you put that in the thread, that York TMS?
Yeah, because I put the wrong thing in there.
Yeah.
Thank you for that.
Yes, please call in 717-846-5067. Our wonderful brother is sharing some heavy jewels with us. Someone got to have a question, especially, I know he said he don't get too deep into the insurance thing, but he does know what is accepted and what isn't. Call in 717-846-5067. It's not every day that you run across someone that's offering a service like this that is so valuable and so needed. We are for everyone on this show here, the Hour of Power, but we put our people first, just like everyone else puts their people first. Yeah,
and one thing I sometimes remember to tell patients when we're doing that informational consultation is that you're not alone. I mean, there are about 280 million people suffering from depression. So
wow, is that many?
Around the world,
around the world.
About
280 million. Yeah, it's not a joke. It's not a joke. Yeah, it is a very high prevalence. Yeah,
like you said, it's nothing to be ashamed of.
No,
and just with me being in mental health, I tell people sometimes the term bipolar is misused.
Yeah.
Because in general, all of us are bipolar. It's a disorder.
Yeah.
When it's in short amount of time and a long period of time. But all of us are bipolar. I could talk to someone today in the morning and be like, "How you doing?" I'm like, "I'm down a little bit. I'm a little down." And then you talk to them a couple hours later, "How you feeling?" "I feel better." That means you just had a change in your mood. But if it's in a short amount of time and more frequent
and the extreme,
then that becomes a bipolar disorder.
Yeah.
But naturally, all of us are bipolar because we have changing moods all day long. Sometimes one person more than another, but it's nothing to be ashamed of.
Yeah.
And you're the one that's going to suffer if you don't, address
Yeah.
whatever's going on.
And just like any physical or other physiological diseases, depression can actually take someone's life away from them. Because I can tell you, when someone is in the depressive state, when someone is suffering from major depression, they are not living. I mean, they're just, I mean, sometimes you'll have patients telling you that they don't want to get out of bed.
Yeah.
They stayed home or in bed for the entire time. And in fact, there are quite a few patients who had to go on disability and lost their job and so on and so forth because they simply suffer from depression. So if you
It's real, man.
if you or someone who is suffering from depression, you really owe it to yourself to check and get evaluated, because that's very important. You can literally give someone their life back.
Yes.
That's a big deal.
Very big.
Man,
And
that's
seek to
deep,
just
man.
put on there as well. Can you talk about the veteran community and so much vets are suffering and how that goes into the homeless? a lot of our vets are homeless, so it's like all that's in one, like the veterans.
She actually touches something that can get me very emotional, because I'm a veteran myself, but so that I don't get too deep into it and to avoid getting too emotional, I would say, this is a population that would clearly benefit from this treatment, because most veterans, unfortunately, would have other medical issues, so they are on multiple medicines, and to be able to manage their medication list by taking away the 2, 3, or 4 antidepressant medicine, I think, to me, it's a great service to them. And for what it's worth, I mean, they served the country, so I think it is that's one population I really wish that I can get access to them. We have some feelers out there to see if we can sit down with groups of veterans and let them introduce this to them. Ask your questions. So why aren't you trying to take advantage of this? This is right there for you. And in fact, I know that TRICARE does cover that. I mean, most veterans have the TRICARE insurance, and we know that TRICARE does cover TMS, and very well, no issues.
We're here to push that. So we definitely we're gonna die on that hill as well as you. You definitely got to take care of our veterans. So we'll be speaking off camera and see what we can use our platform to help bring about change. That's what this is all about.
Yeah.
Brother Ptah, do you want to read Miss Wright? She has a
Oh,
little
yeah.
extensive
This is
message
real
there.
deep. So thank you, Miss Candy Wright. Said, and it says, see you guys talking about this. She's been suffering with depression, bipolar, PTSD for years, and the holiday. Whew. All right. I say I need someone to help me because the medicine that they have me on is not helping me. And just like you said, 1 minute I could be okay, and next minute I'm not. I don't want to continue living my rest of my life like this, or even feel like I'm embarrassed about this need help. And I know others that need it as well, and I'm not afraid to speak up. Thank you for your courage in speaking up, because there's a lot of individuals that don't look forward to the holiday times, because even individuals that may have passed from COVID, this is a time that is really kind of like which you can fast forward through it. So I definitely feel for that. Would you have any words for Miss?
Bipolar would be an off-label used at this point. Now, that being said, I can tell you.
Was I accurate? What I explained? When I explained bipolar, was I accurate?
Yeah. Mm-hmm. Yeah. And that would be an off-label used for TMS, because as of right now, there's no FDA approval for the use of TMS in bipolar patient, and because of that, obviously, insurance companies will give you will put up a fight. That being said, I am aware of some treatments being done for bipolar disorder. Now, I can't report a success rate because it's not done that often to be able to determine that rate. But there are patients I know who accept the treatment and go with that. Yeah.
Okay. Now I know you explained how it was valuable what you just said about because it's so many people that suffer from depression. You said being in the bed all day. I've been there, done that, unfortunately. But what would be your recommendation if someone sees themselves slipped into that slippery slope? What should they do to try to pull themselves out of that?
It's really having the courage to reach out. That's you really need that support system to be able to reach out because unfortunately you don't have the motivation. So it's almost I tell my patients actually a term that I use, it's pre-decide. Even before that happens, you already have a plan in place. So it's like, if I realize that I'm gonna be in that state, I'm gonna call so and so. Now from that point, I take it out of my hands, by calling one of my brothers or my sister, or I know that now because in the state that I am, I will keep sinking in further and further. So therefore, I have to hurry up and take that process out of my hands. So it's like pre-decide ahead of time what you want to do, and then because when you're not in the depressed state, you have all your faculties, and let's just say that your brain is not sleeping. Your synapses are connected, so you can manage your life. You can do all this thing. You can just like you can do a budget and so on and so forth. So as you're doing your budget, you're doing this. Just budget your life also. This is what I'm gonna be doing. If I start going into that state, this is who I'm gonna call, and then that person you give them authority to either call your physicians and things like that. Yeah, yeah.
Do you, without giving up confidentiality of any clients, but do you treat people that is already in the state of addiction of drugs?
That is actually another protocol that's being worked out right now too. Drug addiction, yeah, yeah. But we don't have. It's not indicated for it. That would be an off-label use at this point.
Okay.
Yeah.
Okay.
But if a patient has depression and addiction, you can still treat the depression.
Right.
Yeah.
But not the addiction.
Not the addiction. Yeah, that would be an off-label use. Yeah.
So did I hear you right? Is that something you're going to get into?
Oh, definitely. Yeah, definitely. The
self-medicating is deep, especially like Ptah said around this time of the year with the holidays and what our young sister had shared with us. Holiday blues they call it. That's real, and intoxication goes up from. I remember I used to study it in school. Anywhere from like November the 2nd all the way up through January, intoxication is use, and drug use is even more than any other part of the year.
Yeah. Mm-hmm. The stressors are a lot more.
Wonderful time.
The stressors are there. The triggers are there. Yeah.
Wow, and this has been deep.
Yeah.
This has really been deep. For we get ready to sign off on Channel 16 Local Access TV in about 2 minutes. But if our brother wants to go any further, we can stay live on Facebook Live if you like. But please, someone call in and ask a question. I know someone got to have a question. Don't be shy. 717-846-5067.
Yeah. While we're waiting for a question, I'm going to take advantage of the time to point out the fact again that TMS is not a systemic issue. So the problem with depression involves reduced activity in one part of the brain. It's the left prefrontal cortex. So it's right sitting there. So therefore, if you think of it, why take something that would go through the entire body affecting the entire body. So it's a localized issue. So why don't you treat it at the local level and focus right at the brain? And that's what the TMS for. Systemic side effects from medicine, and I'm quite sure anyone who's taking medicine for antidepressant knows that the issues with the insomnia, the headaches, and the blurred visions, and the fatigues, and the even weight gain, and nausea, and GI issues, and even sexual dysfunction. So all of those things I don't think any one of them is pleasant. So if there's a way you can reduce the risk of systemic side effect with TMS, to me, I think it's a big plus.
Absolutely. And just to repeat for anybody who just tuned in a little bit late, as far as this non-invasive treatment uses electromagnetic pulses, and this is something that is covered with the FDA, and its board is certified, and it's safe, and it just uses very minute subtle waves that's localized in certain portions of your brain after you go through the consultations and everything. So it's really refined science that's been in existence for quite a bit. So please reach out if you got some veterans out there, even if you are repetitively in holiday bluesness, please reach out. We have this wonderful resource here. This is York, PA now. So we got this wonderful brother that's here, has this wonderful organization that's here. So I implore everybody to reach out, and I'm actually going to be putting all your information into the little heading right there. And
Thank you.
Miss Taisha wants to know, we already answered the part that you take Etna Bronze, but she wants to know, do you do video visits? Because she's in North Carolina, but she's very interested in your service.
Yeah, the consultation. Yeah, the first consultation, actually the can be either through a phone call or video visit or in live face to face. Depends on the patient's preference. But yeah.
So you do
The answer is yes.
visits? Yes.
Correct.
Okay, so I hope that answered your question, and it's
But obviously the treatments have to be done, in person. Yeah.
our good brother Dr. Vert, he said he remembers you helped replace his mother's knee many years ago.
Oh, thank you.
Dr. Vert, he's out of Georgia.
Oh, yeah.
To be here,
Yeah.
he said you helped his mother
Yeah.
replace her knee.
Thank you for the recognition.
Mhm.
Thank you. Appreciate it.
A couple other comments there as we wrap up here. Treatment at the local level in laser focus is the smartest thing ever. Miss Sita
Correct.
said that, and Miss Wright said you hit that right on the head, because everything you just said about the side effects of the medicine I'm having. So hopefully we can help you can help Miss Wright get what she needs with her challenges there, which we all have. Is there anything you want to fill in that you may have not?
Oh, she's trying to call in here. I'm sorry.
Oh, 84.
I gave her the number. I was giving the number to
717-846-5067.
Sorry, Tyler.
717-846-5067.
Yeah,
It's on the main screen there.
He said it's a business signal. People trying to call. That's what John said.
It's what? Oh, that means something. That means something isn't hooked up if they're getting. I just called in. Remember?
Yeah.
Try it again, because
Just try again in a couple minutes. I don't. Yeah. This.
Well, they can try now because we're at the 9 o'clock hour.
This thing is hooked up. Let's see. Okay. Try again now. Something had to reset.
Try now, because we definitely want to get your
That's why we
questions
call.
for our wonderful brother here.
Yeah, I'll send a message.
717-846-5067. But until someone calls in, is
Um,
there anything you wanted to?
I sometimes tell patients that think of TMS like the physical therapy for the brain. I mean, it's not invasive.
There we
Yeah.
go.
It's not invasive. You do repetitive motion and you strengthen. Yeah.
Welcome. You are on the Hour of Power broadcast. You are live on the radio or live on TV. May I ask who I'm speaking to?
Yes, Brother John calling in.
Yes, sir. You're coming in loud and clear, Brother John.
Yeah, we're coming through. For some reason, no calls were going through. I was getting a busy signal, and I think everybody else is getting a busy
Yeah, we got it
signal.
fixed right now. You're the first caller. Yes, sir.
Okay. All right. Yeah, I just wanted to call in and mention that I went through a Great Depression, and I'm sure that life circumstances sort of bring on depression. And I can remember, I raised a large family, 8 kids, worked at a full-time job, and operate a grocery business. But I didn't fall into a depression until I ended up losing some children through death and going through a divorce and family being broke up. And that's what I think triggered my depression. So I believe that if I'm correct, a lot of life circumstances, hardship and things of that nature tends to bring on depression, if I'm correct. And I'd like to ask the doctor, America has so many different ethnic groups in this country under the same border. And do you see depression being more in certain ethnic groups like African Americans, Caucasians, Asians, and all that? I'm sure all ethnic groups experience it, but do you see a particular group suffering more from depression than other ethnic groups?
Thank you so much, Brother Jones. Touching to the first comment that you make, talking about the etiology of or the cause of depression was a little bit beyond our discussion today, but you are correct. There are multiple reasons why someone can actually develop depression. However, regardless of the pathway, regardless of the reason, regardless of what the etiology is, from the brain level, from the cellular level, it's because the brain, what it does, the cells of the brain are dormant and they're not active. There's a decreased level of activity, so that's what the focus treatment. So you can still get relief regardless of what the cause is. But I agree with you. There are different triggers. There are different etiology for that. Now the other the question that you ask about the different ethnics. There is actually it's a broader question, honestly, because and we're very reluctant, especially in mental health, to talk much about that, simply because of the stigma associated with it. Because once you start putting numbers out there, people will start hanging on that. But we know very well that, as our dear brother mentioned earlier, African Americans are very reluctant to seek medical help, especially when it comes down to mental health. So right now, if you have to look at the numbers that are prevalent right now, actually the Caucasian complexion seems to be a lot higher than anyone else.
All right. Thank you for your comment, your question. Do you have another question or comment, Brother John? Okay. Others want to call in as well. Can you hear me?
Yeah, that was good. That was good. I was just wondering, because I know the African Americans, we tend to suppress that or not look out for help. But I was one that I did seek treatment and help, and praise be to God, I was able to get back on my feet. But I suffered for almost like 5 years. I couldn't function. Didn't want to get out of bed. Hate to see the sun come up and all those things. So I've experienced it, and I know there's always light at the end of the tunnel.
Amen.
Thank you, my brother.
Thank
You're
you for
welcome.
calling in.
Thank you.
Right.
So anyone else who's listening, if you want to give a call in, we're going to stay on for a little bit longer here on the Facebook stream. The number is 717-846-5067. Now, Taisha, you're trying to call in. Now's a good time, too. But go ahead, Shareef.
And she also asked, is how many sessions?
Yeah. In total, it's 36 sessions.
Okay.
And that's why I was mentioning a little bit earlier that sometimes I talk about TMS like physical therapy for the brain. So it's like you need that repetition. Just like if you want your muscles to be strong, you need to go to the lab and to the gym and keep doing repetition. You don't just go one day and expect that your biceps is really strong, because you need to not only revitalize those neurons, wake them up, essentially. But after waking them up, to have continued and sustained result, you need to do the repetition to strengthen them. So that's why the 36. So the first time it's you do the mapping. The first time we would do the mapping and then do the one treatment and then do a subsequent 5 days a week, basically. Yeah.
As you are live on the Hour of Power broadcast, may I ask who I'm speaking to?
Taisha.
Taisha, yep, we can hear you loud and clear. You go ahead with your comment or your question, please.
Oh, okay. I had a question. I wanted to ask the brother. I was dealing with anxiety, not depression, but I have a daughter that's schizophrenic, and I've been dealing with this since 2017, and now it's 2024. And I know I've been strong dealing with this, all these years. It made my symptoms worse. But I'm not in town. I'm in North Carolina, and maybe 8 or 9 years ago, I heard about the TMS down here in North Carolina, and I wanted to ask you, people that have anxiety, is that good for them?
That is correct. TMS is indicated for major depression and anxiety. And I don't want to rain on your parade, Taisha, but you'll be surprised if you take a formal scoring system. You would find that your depression score is also high, and that's what we see. I'll probably say
because I'm not depressed like what Brother John was saying. He can't get out the bed and all that. I don't have that symptom. If I don't take my medicine, I'll get real anxious and angsty. I'm not depressed. I have anxiety. And that's another thing, too. I went to the doctor a few days ago, and she's trying to increase my medicine. I'm on lamotrigine, 50 milligrams, and she's trying to put me on lamotrigine, 100 milligrams. And I know I'm scared to keep increasing my medicine. So I wanted to do something different. Maybe this can help me. What do you think?
Unfortunately, higher dose or more medicine is not always the answer, because we find out that the side effects are higher the more medicine you're taking and the higher the doses. So I think this can be a valid option for you.
Okay, I understand. Me too, I feel the same way. But the reason why I was asking you about the TMS, because, like I said, North Carolina, back 7 or 8 years ago, I had went to the office, and after they did my examination, they were saying that I wasn't an eligible candidate. That's why I was trying to find out, because I don't have. They was making it seem like you have to have depression in order to get that.
Yeah, there's a scoring system that's used, but I would be very surprised. Rarely I've seen someone's depression score be completely normal with anxiety. Yeah.
Oh, okay. All right then. So, what about the sessions? How many sessions? Somebody said it was a lot of sessions.
Yeah, it is a total of 36, including the mapping, and that's 5 consecutive sessions per week, and you take 2 days off and then start again. Like I was discussing earlier with the brother, it's like physical therapy. You if you have your an injury, or you have your joint replaced, you don't just go to one therapy session and think that's enough.
Like
You
learning
know,
how to walk.
well, learning how to walk again, yeah. You have to keep doing it, and it's the repetition. Or even if you go into the gym, for example, to get stronger muscles, you don't just go one time. You just have to keep doing it. It's the
Yeah, yeah, keep
repetition.
going.
Exactly, it's the
Yeah, I
repetition that
understand.
strengthens it. Yeah.
And if I
I
can add just one little bit of information for anybody who's listening right now, they might hear that 36 sessions, and we're in a world where we think everything is kind of instant. There's a gentleman named Dr. Joe Dispenza that deals with neurology and neurotherapy. He has this thing. He said, synapses that fire together, wire together. So when your brain, the way even when you're what the things that you're focused on, the more you keep it up, you're guaranteed to have the effect. So I would say have patience. This is something that is proven, and
Oh, I even have a very practical answer for patients who are a little bit concerned about the time. Okay, the average time per session is about 19 minutes. Okay, so
Oh,
yeah,
it's short.
it's short. Yeah, so you take 19 minutes and you divide that by 36, and then you multiply it by 36, then you divide it by 60. That's less than 12 hours of your time. So that I think if I suffer from depression, I wouldn't mind giving 12 to my life to recover. Exactly. Yeah, because obviously with from depression or anxiety, you literally lose more than 12 hours of your life. I mean, just by not being able to do the things that you like to do, when you're getting, and I'm going to use the term, crippled by your symptoms. So, yeah. So
I
yeah.
understand.
Yeah.
And one more question I wanted to ask you. What about like your insurance? Do you take Aetna Bronze?
yes, you answered that.
Yes.
Oh, okay then. You said you take it. Okay then. Well, yeah, and I see Ptah put your information, so I'm gonna check it out.
Great.
I'm gonna check it out.
All right.
Thank you for calling in.
Thank you
Have
for
a
calling
pleasure
in.
to hear you.
Okay. All right. Thank you.
Yes,
Have a good one, y'all.
Okay.
Beautiful, powerful.
Anything else you wanted to share as we wrap up? We thank you so much for these gems, and this is life changing.
Yeah,
you know?
well,
and like Ptah said, we're more than a TV show. We are here for ourselves and here for each other. So
Yeah, well, I really
Reach
want to
out.
thank you for the opportunity. I think you guys, I mean, kudos. You're doing a great service to the community there. That's bringing the information right to the community. And as we know, we need to educate our people. We need, yeah.
thank you. Thank you so much, brother. I hope this isn't the last time that we have you on the set. You're welcome on the set at any time. And you're gonna be seeing me. You know,
Great.
I'm not ashamed to say.
Yeah.
You know, a therapist, it needs a therapist.
Great.
You want to mention the next week's guest?
Yes. Please tune in next week, January the 8th, same bat time, same bat place. We will have Imam Earl Abdul Malik, who is the successor of Imam W.D. Muhammad, who is the seventh son of Elijah Muhammad. He will be tuning in and sharing his wisdom and his mission as being the successor of Imam W.D. Muhammad. May he rest in peace. So thank you for tuning in to the Hour of Power. Please share this video tonight, and it will be on replay immediately on my page. And if the good doctor shares it to his page, you can go to his page. But at the least, it'll be on my page. Thank you for your participation. Sorry about the phone being busy there, but I think everyone was able to call in and get their questions in. This has been more than powerful. What a great way to start out the new year. 2024 was challenging for many, but God don't put more on us than we can bear. And I pray for ease for myself in 2025 and ease for all my brothers and sisters going into 2025. We leave you in peace as we came. Assalamu alaikum.